We are here with leading dermatologist Dr. Kiran Sethi, who is going to answer lots of skincare questions. Let me shoot. Skincare for the season.
Skincare for the season. It's hot outside. Everyone is sweating like crazy. And from that sweat, a lot of people are feeling dehydrated. So we're not getting a lot of humidity right now in Delhi. Right now we're having dry heat and everyone's indoors in the air conditioning. So for that, actually, I want you to use water-based hyaluronic acid serums. And I still want you to use more light gel-based lotions to moisturize, because in this heat, anything thick is gonna feel uncomfortable. And I want you to use gel-based sunblocks, but I want you to reapply every few hours. The heat and the sun are guaranteed to cause more pigmentation and more sun damage and more tanning, while the dry, dehydrated air will make you feel more dehydrated and flaky. So for that, we've covered with hyaluronic acid serums and with sunblock.
Oh my God, I don't want to step out. What is the skincare that people in their 40s and 50s need to follow?
The signs of aging actually start in our 30s, in which case there's nothing wrong with aging per se. Fine lines are normal part of using your face. Sagging is normal, you use your phone a lot, we're looking down. It's just how our skin ages. Our muscle tone in our faces is much weaker than probably in other races. You'll notice that skin might be less tight. So you'll start to see it a little bit in your 30s, and it worsens over your 40s and 50s. In your 40s, we look more at fine lines and the early signs of sagging. In our 50s, we look at fine lines, sagging, and definitely more hydration. So what do we look at? In our 40s, we definitely want to make sure we're on our retinols, but we should have been on it in our 30s. If you're dry, then it's not retinol, it's peptides. We definitely always want our topical antioxidants. Very often we'll see a lot of pigmentation in our 40s because cumulative sun exposure will worsen pigmentation. And you'll start to see it more in the late 30s, mid 30s to 40s. Anti-pigmentation creams are great, and good moisturizers, especially if you're dry. In our 50s, we start looking at other things. We start looking at dehydration due to menopause. People don't talk enough about how much menopause affects the
Tell me
skin.
about perimenopause and menopause, and what are the kind of preventive things they can do, and what happens after?
So in menopause, the type of estrogen that you make changes, and you notice the change. You'll feel more dry, your skin is dry, your skin has less, the collagen is definitely degrading faster, a lot more sagging, the lines are worse, and it's a significant shift after menopause. Also, there's a difference in the way you process fat, so your facial fat looks different. Some people hollow about in here, in this area. So they start to look older. The weakening of the double chin, the weakening of the neck, the aging of the hands. Post-menopause, it's a stark difference from pre-menopause, how that hormonal milieu changes everything. So there, again, hydration is really key.
When you say hydration, what do you mean?
I mean,
will a moisturizer change everything?
No, I mean, you have to use heavier moisturizers, and like I was saying, you have to use oils. These are times when you're drier, and the more you moisturize the skin, the better it's going to be for you, because you can't hold moisture as well in the skin as you age. And here, neck skin, hand skin, these are all areas that start to become way more relevant and more noticeable. So here, that's when you start to notice these things even more than you did in your 40s, and maybe you want to start working on it. It depends though, each person. Some people get it more in their 40s, in their 50s, some people in their 30s. Everyone ages differently visually. So we also look at that. We also look at dietary interventions. Sugar is the #1 ager. So sugar ages you like no one's business. The more sugar you have, the more you'll age. Alcohol's not so good for you either. Neither is smoking. Pollution is not great. Pollution also ages. And processed foods probably are aging you because they're increasing your insulin response, which will again behave like sugar does. So our diet is a big impact as well.
Oh my God, that's so much. Suggest some of the seamless work done by celebrities in their 40s and 50s that you've noticed, and we have no idea.
Guys, let me be really honest with you. Celebrities are doing their treatments and skincare probably from the moment they start entering the stage, or even before that. So if you think they just started their skincare or treatments in their 40s or 50s, you're wrong. Frankly, they have been doing things that are preventative probably once a week, once in 2 weeks, once a month for decades, and they have been working to prevent. They have been doing their peels, their laser facials, their radio frequency treatments to tone and tighten their skin, their muscle stimulation to tone and tighten their muscles. They have been doing it all, and their retinols or their peptides and their vitamin C and their sunblock. They have been doing it for longer than you can imagine. In our 40s and 50s, though, they start to get probably even more invasive than they already were. Were they probably already doing injectables? Yes. Were they probably already doing their boosters? Yes. But now, because the 40s and 50s really start to show our age, they start to do things like Ulthera. Ulthera is a fabulous treatment that's US FDA approved that will tighten the tissue. You'll see a great lift and it's non-invasive. You'll see them do more injectables very often. Honestly, 40s and 50s, at least in Hollywood, I would suspect that there's a lot more surgical options happening than you realize. People all of a sudden that their nose looks sharper, or they don't have any under eye bags, or their neck is super tight. They've probably been to the surgeon, so you're expecting that some magical cream will make your neck tight like Jane Fonda? I would doubt that, but of course I'm not their doctor, so disclaimer, 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 and who am I to say anything, but this is my objective guess.
All right. Now, the current tweens, which is the generation before the teenagers, kids between 9 to 12, girls especially, are obsessed with their skincare routine. How bad, how damaging is it for their skin, and what products do you recommend?
Tweenagers and teenagers, no skincare for you. You do not need vitamin C. You do not need retinol. Why are people using retinol in their age 12? It doesn't make any sense. You cannot bank collagen. There's no collagen banking. It's not like a bank that you put your collagen in, okay? At this age, you have the youngest, healthiest, most supple skin you have. You cannot prevent aging like this. What all kids need is moisturizer and sunblock. That is it. Moisturize, sunblock. Moisturize, sunblock.
Any brand of moisturizer you would recommend for kids?
Typically, you don't use need to use anything that's fragranced or colored. You want to keep it paraben free. Keep it clean as you can for kids. And sunblocks as well. I want mineral sunblocks. Chemical sunscreens have been shown, 7 of them, 7 ingredients, can enter the bloodstream, which the US FDA has mentioned. Kids' skin barrier is thinner than adults. So I personally always recommend parents to use mineral sunblock on their kids. Parents then come back and say they hate the white cast, what do I do? And then I say, now you have to understand that you have to balance the risk and the benefit. Because for my kid, she deals with a white cast and she knows she needs to wear it.
But which brands of mineral sunblock do you have in India?
So I use Ultrasun Pediatrics on my daughter. I think it's great. It's Ultrasun Mineral Pediatric. That's what I use for my child. Then any 100% mineral kids sunblock is probably the way to go. Good moisturizers as well. That's it. No vitamin C for you guys.
And this current generation of the preteens, the tweens, are so obsessed if they see like a tiny pimple or something on their face. It's catastrophic. So what is the kind of skincare solution for that age?
I believe we should follow Dr. Haight's recommendation, which is remove social media from our children until they're 16. So social media is not a safe place for our children. They are seeing images of young people with perfect photoshopped skin or photo-tuned skin or whatever you guys call it these days. And they're thinking that that's normal. And when they can't match up to it, they can't handle it. It's a very stressful place to be, and kids' brains don't develop like adults do, where they can understand that the world is not about them. Their neurological development, their neurons are also still forming, and we're giving them a device that they can look at 12 hours a day at any point in time, where people are constantly sending feedback that they have to look like this perfect influencer. Social media needs to be removed from children. A pimple, acne in kids is a very normal occurrence, and they are stressed about acne no matter what generation we're talking about. But the fear associated with all of these concerns is a lot more in this generation than I've seen previously. And I've been working in Delhi for 10 years now, more than 10 years. TikTok trends is not reality. TikTok trends that travel to Instagram then travel to your child, that should not dictate how your children do their skincare. Their body care should be gentle body washes that don't strip the skin, unfragranced, and good body lotions. Their skincare should be gentle cleansers, good moisturizers, and sunblock. If they have a medical concern, they should go to the doctor and get treated. Beyond that, your child should be a child.
Lovely. Now we go back to adult skincare issues.
Adulting!
When is a perfect time to use vitamin C? Because you did mention that one should use vitamin C. But what is the ideal time? Morning, noon, night?
So I believe in using a vitamin C or a topical coenzyme Q10 or a ferulic acid, and I'll explain to you what the differences are, in the morning, right before your sunblock. So what happens is your sunblock will give you about 40% protection from sun damage. The topical antioxidant will add another 20-30% to that. So we're looking at the oxidative damage from UV rays along with prevention of other damage that's caused by sun. And the topical antioxidant is protective. I'm not looking for it to make me glow. I'm not looking for it to make my pigmentation go away. In this case, when I'm using it in the morning, right before my sunblock, I'm looking to help it protect me from sun damage. If I'm using a vitamin C at night, I'm using it for a whole other purpose, because usually that vitamin C will absorb, and probably you need it right before sun exposure for protection. If I'm using it at night, I might be using it then for glow. Maybe I'm using it for pigmentation. So then the vitamin C purpose is different. So if you're using it I believe everyone should use it in the morning before sun exposure and before their sunblock. And at night you can add it on if you want glow or pigmentation benefit.
Wow.
Or collagen benefit.
Is rosemary oil the elixir for good hair?
Rosemary oil is fabulous in the way that if you use it properly. So if you're getting a rosemary oil shampoo, waste of your time. If you're getting like rosemary extract in a general lotion, waste of your time. Where does this concept come from? This concept came from, they took an excipient of rosemary oil called cineol and put 3.8 milligrams of it and applied it twice a day for 6 months and compared it to minoxidil. Minoxidil is the gold standard of hair growth, and they found equivalent results. It was a small study, but it was relevant. The problem is people sort of bastardize it. They take, oh, there's rosemary in this air spray. I mean, that's not going to increase your hair growth. You want pure rosemary, pure extract, use it twice a day, then it has benefit. It will have no benefit to you in a random shampoo.
Collagen face masks, do they help, or should one eat collagen instead?
No, collagen masks are not effective.
So one should just eat the collagen?
Eat the collagen.
And see results after 1 year?
6 months to 1 year.
All right. And any collagen you recommend?
I really
Vital proteins?
I like vital proteins, but that's bovine. Neocell is bovine. I prefer international brands simply because we know the safety profile, right? Indian brands, I usually honestly prescribe international brands to my clients or recommend that.
How does one get a radiant look? Is it consuming vitamin C? Is it water fast? Is it just like applying lots of moisturizer? What's the secret?
Radiant glow. Okay, so each person has different needs for radiant glow. So what does radiant glow mean to you? That's one. Two is radiant glow often requires great diet. You know, lots of vegetables, lots of fruit, high in protein, low in high glycemic foods, low in processed foods, low in alcohol. Cigarettes are not going to give you a radiant glow, neither will vaping. I mean, these are obvious. Drinking a lot of water. Exercise, good circulation to your body and to your face will always help you, give you a glow. And then we talk skincare, topical vitamin C or antioxidants, hyaluronic acid. Alpha hydroxy acids are great at resurfacing the skin and adding some luminosity. And then mica particles in your skincare will always make you look more glowy. The thing is when all of that fails, then we have to look at procedures, in which case we look at microneedling in PRP or microneedling in hyaluronic acid or even injectable moisturizers like Volite.
Sounds amazing. Are these products worth it? One keeps seeing them on Instagram. New Face or Dennis Gross LED light mask.
So LED masks can help boost your collagen by a certain percentage points, a few percentage points to be very honest with you, if you do it a few times a week for at least 3 to 6 months. Is it a significant change? Probably not. If you're using blue light a few times a week for 3 months, you can actually get a benefit on your acne. So that is definitely a great benefit. Red light has collagen boosting. You can get a certain percentage of collagen boosting, but will it give you significant external results? So what's our metric? Will you feel more glowy? A little bit. Will it be hugely significant? Probably not. Okay. But it's a great add-on to whatever you're doing because it can't really harm you as long as you have a good US FDA or CE approved brand. You want to make sure it's not unregulated because if the energy is too high, it does the opposite benefit. So you don't cheap out and buy something super cheap. It's not the same. You want something that's regulated. And you have to do it in addition to everything else you're doing. The other thing is the microcurrent devices, the ones that strengthen the muscles. I really like them because there's something you can do at home. So if you don't have the time or the budget to go to a clinic and do something more powerful, then at least here you're getting 5-10% benefit of muscle toning. It's something you can do at home. There's no harm to it as long as you're doing it correctly. But you can't expect miracles from it. And if you want something significant, then you will have to go into a clinic.
All right. Now, we asked some of our viewers on Instagram for some questions, and they sent lots of them. Who does not want a dermatologist advice? All right, I'll shoot. There's so many questions. Okay. Creams for stretch mark removal.
They don't work.
Okay. Tips for itchy scalp in summer.
If you have seborrheic dermatitis or dandruff, then you must use a shampoo that treats that. So use the anti-dandruff shampoo, a good one.
Which one?
There are certain brands. You have to look for zinc pyrithione, you have to look for salicylic acid. These are great, selenium sulfide, these are great actives to look for. You have to apply for 5 minutes and then wash off 3 times a week, and no oiling and no hair serums.
All right. Best sunscreen and moisturizer.
Oh gosh, there's too many sunscreens that are great. I really love, I personally use on myself is Clinical Eclipse. I use HelioCare Mineral. I use Kula Sunblock, Crystal Tomato. These are my favorite sunblocks. I prefer mineral sunblocks for myself, frankly. I use that a lot. I also, if I really need a non-mineral sunblock, then I use Supergoop from the USA.
Okay. Would you recommend the Morpheus treatment for deep acne scars?
So Morpheus is a type of microneedle RF. The microneedle RF, there's lots of brands. There's Morpheus, there's Delphina, there's Silver, there's a whole host of brands out there. Secret, there's so many brands out there. So the technology is microneedle RF. Do I like microneedle RF? Absolutely. It's actually one of my favorite treatments out there for scars, for fine lines, for a little bit of tightening, for overall texture. People do our procedure. We have Delphina in my clinic. They actually look shinier, tighter, skin is much healthier after a few sessions. And frankly, it's one of our most commonly requested therapies from my patients. I think it's phenomenal. Microneedle RF is phenomenal for that. But there are other technologies also for scars. For example, there is Atmos Plasma, which is atmospheric air that's been ionized to work on the skin. So that's a very new and advanced technology for scars. I think that's also great. Boosters that stretch the scar out, like Viscoderm, that's phenomenal. CO2 lasers, erbium YAG lasers. These are my favorite treatments for acne scars. Your practitioner and your doctor, your aesthetic physician, your dermatologist, whoever you're working with, should know how to use the technologies to give you the most optimal result possible. They should have all of the technologies they can, ideally, because if one isn't working, then you should have the other option. Also, after a certain point, the scar won't respond to a certain technology, so the option to change and increase results should also be there after a certain number of sessions.
Okay. How to shrink pores topically?
Topically shrinking pores is hard. All you can do is try to reduce oil secretion. So clays can help to soak up the oil. Salicylic acid can help to reduce oil secretion. Niacinamide can help to reduce oil secretion. So can green tea help to reduce oil secretion. So I have a skincare line coming out and I have researched this topic, and anti-oil is a huge thing, and it's the right percentages and the right ingredients to really reduce oil secretion and soak up the oil.
Any food restrictions for people suffering from psoriasis?
So food restrictions actually is a great point. So psoriasis, very often, a lot of it can be improved or even controlled in some cases by dietary intervention. So the first thing I do for psoriasis patients, or my team does for psoriasis patients, is we'd work at dietary interventions. So reduce high glycemic foods, we reduce sugar, artificial foods are gone, processed foods are gone. We even look at killing gluten in the system. So anything that could be triggering the system, we work on. And that makes, honestly, a significant change. So yeah, dietary intervention is a go.
What is the treatment for melasma?
The treatment for melasma is multivariable, which means that we need topical creams, we need sometimes oral medications. We start with lasers very often. If lasers aren't doing enough job, we look at microneedling. Sometimes we look at PRP, we look at injectable mesotherapy. With melasma, we actually have to be very creative because melasma is one of the hardest diseases to treat. When something is that hard to treat, we have to always be cautious. We have to go gently, we have to go slowly. After that, we have to see and maintain the result that we get, because melasma can flare at any time. It can flare in this heat, it can flare due to stress, it can flare during menopause, it can flare during pregnancy. So melasma is one of the hardest diseases we treat. Consider it like blood pressure. It's something you're going to have for many, many, many years.
What is melasma?
Melasma is a type of pigmentation. You can get here, you can get it
The
here,
black,
you can get it
the
forehead,
really
you have the
dark
patches,
one.
you can get it on the
Wow.
mandible. You can get it in
Oh
a
my
multitude
God.
of different
Okay.
locations.
Please tell us a bit about alopecia areata, how to avoid it, and if you have it, what do you do?
Alopecia areata, it's not something you can particularly avoid, but alopecia areata is usually an autoimmune condition where patches of hair loss can happen. If that happens, you check your thyroid, you check your liver enzymes, you make sure that you have no vitamin deficiencies, and then you start getting it treated. That's about it.
Pregnancy skincare suggestion.
In pregnancy, your job is just to keep the skin calm. So if you have acne, you treat the acne. If you are feeling dull, you can use some alpha hydroxy acids. But really at the end of the day, pregnancy is all about just nourishing yourself and just protecting your baby. So there's nothing you can do to prevent what's coming, to be honest, except wearing sunblock.
And a mineral sunblock at that, right?
Mineral!
Keratosis pilaris. Any remedy to fix pus-filled bumps and its marks?
Keratosis pilaris is chicken skin of the legs, arms, back. It can actually occur in any area, whether you shave or don't shave. It's bumpy. It can be white and pus-filled. It can also just have a little flake on top, which is keratin. If it's white and pus-filled, usually you need to do an antibiotic because there might be some superimposed folliculitis, so it's a topical antibiotic. And then the extra bumps and everything like that, first you have to stop repetitive hair removal. So if you're shaving or if you're waxing, you have to stop it. And usually either you stop and you just let the hair grow, or you do laser hair removal, where you may have to do a little bit of shaving before the laser hair removal, because you can't do laser hair removal without shaving. But other than that, you remove as much repetitive hair removal as you can. Once the hair stops growing in that area, then you can start working on the marks.
Okay. A question comes from Miss Chaudhary. I always apply ISDIN, yet hands are always 2 to 3 shades darker than the rest of my body and face post holidays.
So the arms, you have to use a huge amount of quantity of sunblock. It's possible that your sunblock is not strong enough. Maybe you need to use a stronger sunblock. It easily gets rubbed off, so you have to reapply more regularly. And maybe you want to double up the sunblock. And also please understand, usually you're not paying attention to your arms. You're just wandering around, you're sitting in the car, your hand is here outside on the window, your arm is here outside on the window. It has a lot more sun exposure than you expect. Everyone is more careful with their face and the neck than their arms and hands.
Is Tripla good to consume?
I am not an Ayurvedic doctor, I have no comment.
All right. Best ingredients for eye creams for 40-plus-year-olds?
Eye creams you have to consider in a 40-plus-year-old as more preventative. Perhaps you want to use a retinol eye cream if you're not dry. Maybe you want to use something with growth factors for preventing aging. Besides that, if you think an under eye cream will solve your problems, you are wrong. I'm sorry to state.
Last question. Do collagen powders work? They do, you said.
I like collagen powders. I like collagen supplements. In many cases, although not in 100% of cases, it improves suppleness, it improves elasticity of the skin, it can improve joints, it can improve wound healing. It has a benefit. And what I like is it's also kind of derived from Ayurveda. So, the bone broth that we have in winter in India?
Yeah.
That is chock full of collagen.
But somebody says that if you have protein powders and they do have a bit of collagen in them, but they say protein powders are not good for your gut because they're hard to digest apparently and they cause other issues.
So whey protein or whey isolate is pure whey, and whey isolate does not have collagen in it. So that's a completely different kind of thing. There's no collagen in that situation. I don't like whey protein powders because they can very often have androgenic effects, which means they can increase hair fall, they can increase acne. I've seen cases where this has happened, so I tend to avoid them. Regarding gut health and whey protein, I actually don't know, but I'm not a fan of it. Now regarding collagen powders actually can improve gut health. So if it's used regularly, we do find that it can actually help with gut health per se.
I think I'm going to go buy a box of collagen just after I say goodbye to you. Thank you so much for your time.
Thank you so much for having me.